Cancer is not a single word, rather, it refers to a wide range of organs and tissues. It is a condition that develops when cellular alterations lead to excessive cell growth and division that is out of control. While certain tumors cause cells to grow and divide more slowly, others cause cells to grow and divide more quickly. Tumors are obvious growths that are caused by a variety of cancers. Leukemia is one of those that does not. If you are tuning in for the first time, please subscribe to help our platform grow to deliver you the best awareness for a better life for all naturally. The body contains several cells, each of which has a distinct lifespan and purpose. Apoptosis, which may sound like a bad event, is a natural and advantageous phenomenon that includes cell death. In order for the body to replace it with a newer, more effective cell, a cell is instructed to die. As a result, they build up in the body and begin to consume the nutrients and oxygen that would otherwise support other cells. The body may be unable to function at its best due to tumors, immune system problems, and other alterations brought on by cancer cells. Anywhere in the body, cancer might exhibit the following symptoms. 1. Chronic cough. If you have a horrible cough that has persisted for at least a month, it's time to schedule a visit with your doctor. One of the most prevalent signs of lung cancer is a persistent, annoying cough. In 2020, the U.S. is expected to see more than 228,000 new cases of lung and bronchus cancer, with more than 142,000 patients expected to pass away from the condition, according to the American Cancer Society. 2. Changes in bowel movements. We understand that no one likes discussing their excrement, but paying attention to your defecation cycle and pattern might reveal a lot about your general health. Constipation, diarrhea, or even pencil-thin stools might be symptoms of colorectal cancer that affect bowel motions. It's crucial to keep in mind that you should see your doctor right away if you have a bowel movement but don't feel relieved or notice blood in your feces. 3. Anemia. Anemia and an increased risk of cancer have been linked in a concerning way by researchers studying iron deficiency. Though the exact cause is yet unknown, one theory suggests that iron deficiency-related immune behavior shift may be to blame. Cancers of the pancreas, kidneys, liver, and bladder can occur in anemic people. Consult your doctor about your possible risk of cancer if you have iron deficiency anemia. 4. Breast adaptations. Despite being one of the most well-known types of cancer in the country, breast cancer is also one of the most common. The American Cancer Society predicts that there will be about 271,000 new cases of breast cancer diagnosed in 2025, and 42,260 patients will pass away from the disease. Early detection, rapid treatment, and a greater likelihood of survival can all be achieved by recognizing the warning symptoms, which include breast lumps, discharge from the nipple, and a change in breast texture. 5. Changes in the male genital. Male genitals are susceptible to alterations brought on by cancer, just as female breasts. Although the American Cancer Society predicts 9,560 instances of testicular cancer in 2020, the survival rate is extraordinarily high, at around 95% after 5 years. Men should look for strange or recent lumps in the tests in addition to a feeling of heaviness. Men should perform monthly self-checks in addition to an annual health examination. 6. Urination challenges. The inability to urinate easily is another sign of cancer that people, especially males, should watch out for. It's time to see the doctor if you have a slow stream of urine or intermittent urinating. One well-known sign of prostate cancer is difficulty urinating. Men must be examined as soon as possible because early detection is linked to a survival probability of nearly 100% over 5 years. If you are still tuned in, please like, comment, and subscribe to help an ever-growing community that thrives on wellness and natural health. Let us continue. 7. Lumpy surfaces. While most individuals are aware of how to recognize lumps in the testicles and breasts, many are unaware that a doctor must also assess other foreign lumps on a patient's body. There is evidence that lymphoma, lymph node cancer, can result in neck, groin, or underarm lumps. Lumpiness can be caused by other malignancies, such as soft tissue sarcomas, in the arms, legs, or belly. If unsure, have a breast expert or your doctor examine you. 8. Skin alterations. Many individuals are aware that if a mole changes in size, color, or shape, they should consult a doctor, indicative of melanoma. Most individuals are unaware that other forms of skin cancer, like basal cell carcinomas and squamous cell carcinomas, also manifest themselves as elevated skin patches at the beginning of their development. As early indicators of skin cancer, pay attention to any scratchy lumps or elevated waxy patches that are not healing. 9. Having trouble swallowing. Dysphagia, another name for the issue with swallowing, is not to be discounted. The ailment can be an indication of esophageal cancer. It's crucial to have a doctor examine you even if swallowing food and liquids only causes slight discomfort so they can rule out anything more serious. According to the American Cancer Society, more than 17,000 people will be diagnosed with esophageal cancer in 2020 alone, and an alarmingly high amount, 16,080, of people will pass away from the condition. 10. Vaginal discharge or abnormal bleeding. A doctor should be consulted for any unusual vaginal bleeding or discharge. The signs of endometrial, cervical, or uterine cancer may manifest as bleeding between cycles. You should also tell your doctor if you have a vaginal discharge that is tiny, watery, red, brown, and/or has a distinct scent. It's crucial to be sure that these symptoms are not preliminary indications of tumors of the reproductive system, even though other medical conditions, including hormonal imbalances and infections, may also cause them. 11. Infected areas that aren't healing. Make an appointment with your doctor if you have a wound that is not healing, or better yet, a dermatologist. Both basal cell carcinoma and squamous cell carcinoma are skin malignancies that result in persistent open sores. Even though there are numerous additional reasons for non-healing wounds, including diabetes, skin ulcers, and more, it's crucial to seek treatment right away to stop the spread of infection. With all these symptoms listed out there, we have only just scratched the surface. Exercise and eating healthy goes without say when it comes to the fight for a healthy life. We encourage you to check out our other videos as we fight to keep you healthy as we push the message of wellness.